I know Michael very well. I've known him for over 10 years and watched his growth as not only as a clinician, but as really a leader of helping troubled families, troubled communities, and he just does a great job. First of all, Michael's an author of Tech Talk, Strategies for Families in a Digital World. I'd highly recommend it. It's our Sunday Visitor, just came out about a year ago, about kind of the temptation for the kind of digital thing to kind of take over a family. So Michael has strategies about keep that, find a healthy balance on that as well. He talks on parenting a lot, technology, relationships, really kind of around the world, Canada and the UK, even, as well as here in the States in our diocese. He's a local guy. Michael lives in Fredericksburg. And then Catholic Charities, he's the director of all of our clinical programs, including our Mother of Mercy clinic and all the mental health and counseling. He is a psychologist as well. Went to, I think it's Divine Mercy. It used to be called Institute for Psychological Science, Divine Mercy. Now it's called a local here. He's an expert also in child play therapy. His dissertation was on violent video games and their influence on the player. He writes a blog at www.theduckeffect.com. All this is in your notes here, in your packet. One thing I want to say about Michael was unusual about him, a lot of things. One is his default setting is yes. You want me to do something crazy? Yes, that kind of thing. He thinks yes first, and sometimes I'm a direct supervisor. One of the few people you supervise, you have to pull them in, not motivate them. You got to pull them in. You got to pull them in. He's very committed to helping people and things. He's also a clinician who's also willing to be a leader, not just helping the client in front of him with a particular problem in that family, but looking at kind of raising the scope and taking a look throughout the community for the common good to have people helped and transformed. So he's going to kind of walk us through this problem. How about a round of applause for Dr. Michael Horne?
So, first of all, I'd like to pick up with what Art and Bishop were saying and thank some key people. Thank you, Bishop, for your leadership. We would not be here if it was not for you and your challenge to Catholic Charities and to all of us to address the opioid issue actively and not just passively allow this to continue. Thank you to everyone at Good Shepherd for hosting us. But most importantly, thank you to all of you. Thank you for coming out on a Saturday to talk about a solution. Because as you will see, the focus of today, this is not the end. This is the beginning of a conversation, and we hope that with your assistance, we will have a broad impact across the 21 counties of our diocese. Building also on something that Bishop said, today is the Feast of the Archangels. And when we think of the archangels, in Catholic tradition, saints and archangels are the patrons of certain areas. St. Michael is the patron of police, paramedics, and firefighters. And we ask for his intercession for protection and defense against evil. St. Raphael, whose name means God heals, is the patron of blindness and bodily ills. And St. Gabriel is the patron of messengers. With that in mind, what is our message today? What is our focus today? I think it is threefold. We want to raise awareness of this particular issue and the intrinsic evil of the opioid crisis and scourge in our community. We want to bring hope that healing is possible. And we want to call our communities to respond on a local level, pushing out from here into our own neighborhoods. So to accomplish that, today I'm going to cover four things in my keynote. First, I'm going to provide an overview on the state of the opioid crisis, both nationally, but then also within the diocese. We'll talk about the difference between legal and illegal opioids. We'll discuss the effect that opioids have on those who use them. And finally, I will start discussing the response from the diocese and from Catholic Charities and providing some thoughts on possible next steps. But to begin, I'd like to introduce John. John is 35 years old, and he is a heroin addict. He bounces between shelters and sleeping on the street. He's had some run-ins with the police for petty theft, and has done some time in jail for possession crimes. Previously, John worked in sales, but he was fired from his job for performance problems due in large part to his addiction. John is the father of 2 children, sons aged 10 and 8. And John's wife died 5 years ago in a tragic car accident where she was hit by a drunk driver. John's children are currently being raised by his parents, and John hasn't seen either of his sons in the last 18 months. How did this start? 4 years ago, John was trying to build a tree house for his sons, fell out of a tree, and hurt his back. So badly that he went to his doctor and was given a prescription for oxycodone, which is an opioid-based painkiller. John started taking more of his painkiller medications than he should. It helped with his back pain, but it also helped him cope with all of the grief and losses that he had really been struggling to manage with the transition to being a single father and the loss of his wife. John liked the way that he felt. And after his first prescription ran out, he got another. And then went to another doctor and got a third. And sooner or later, he was no longer able to obtain prescriptions and started looking for drugs on the street. While John isn't real, this story is not far from real life. I'd like to give you some broad stats on opioids now in our country. In 2017, 72,000 Americans died from drug overdoses. This number is twice as high as it was 10 years ago. Of those 72,000, 49,000 were specifically related to opioids. And this is 4 times higher than it was in 2002. Now, these are just cases in which the cause of death was due to an overdose. This doesn't take into account the long-term health impacts and ramifications of extended drug use. And according to some data published by SAMHSA, the Substance Abuse and Mental Health Services Administration, in 2016, 11.5 million Americans aged 12 and up misused prescription painkillers. Almost 1 million Americans aged 12 and up used heroin. So while the fatalities are hugely troubling, it only begins to capture the full scope of the crisis that we are facing. Let's talk briefly about opioids. One question that I would get a lot is, okay, now hang on, what exactly are opioids? Heroin's an opioid, I know that, but what else is an opioid? In the most broad terms, opioids are a group of pain-relieving drugs that work by interacting with the opioid receptors in the brain. The opioid receptors in the brain control our feelings of pain and sensations of pleasure. Opioids can be made naturally from poppy plants, this is where we get morphine, or synthetically in a lab, such as fentanyl, which I'll speak about at length in a few minutes. When an opioid is ingested, it travels through the bloodstream and attaches itself to the opioid receptors in the brain. The receptors then release signals to the brain that dull any feelings of pain and increase feelings of pleasure. For painkillers, they are incredibly effective. Now let's speak for a minute about the differences between legal and illegal opioids. Legal opioids are prescription painkillers. These are things like oxycodone, Percocet, morphine, methadone, codeine. And these have been used for a very long time because they are so incredibly effective at addressing pain in people who are truly suffering. However, within the last 5 years, the medical community started to realize just how addictive these painkillers are. Recent research suggests that with just a 10-day prescription of opioid painkillers, 1 in 5 people develop an increased risk to opioid addiction. 20% of people, after a week and a half, develop an increased risk to opioid addiction. Compare that to the stats that 20 to 30% of patients prescribed legal opioids for chronic pain misuse them. And also include the fact that about 80% of people who use heroin first misused prescription opioids. So you can see a clear path. It's the misuse of legal opioids that appears to be a much more significant problem and gateway to what we classically think of as an opioid issue: heroin and people on the streets. From 1999 to 2016, more than 200,000 people in this country died from overdoses related to prescription opioids. And the overdose deaths involving prescription opioids were 5 times higher in 2016 than they were in 1999. Now, please let me be clear. I am not looking to blame the medical professionals, but it's important to raise awareness. And by and large, opioid-based prescriptions are decreasing as the medical community becomes more aware of the risks and pitfalls of managing pain in this way. Many doctors are looking into alternative pain management, so we're not as reliant on those opioid-based painkillers. Shifting gears now to illegal opioids. Heroin is chief among them. Now, heroin is currently very popular among drug users. Drugs do cycle in terms of their popularity. Cocaine was very popular for a while. Now it is heroin that is in vogue. It can be smoked. It can be snorted. However, all of those things ultimately lead to intravenous injection. Because what happens is that over time, with opioids, as with any substance, our body builds up a tolerance. I used to be able to get drunk on 3 beers. But now I need 5 or 6 to develop the same level of buzz that I'm used to. The same is true with opioids. The more someone takes a substance, the more their brain adapts to it, and the more is needed to reach the previous levels of high or pleasure. This leads to intravenous injection because that is the most potent form of delivery for opioids. A word now about fentanyl. Fentanyl has been increasingly prevalent within the news. It's a synthetically made opioid, which is 100 times more potent than morphine and cheap. It's incredibly easy to manufacture at very low costs. This is such a dangerous substance that when police come across it in drug raids, they have to leave the premises and return wearing hazmat gear. Because there have been instances of law enforcement officers overdosing simply by handling bags of fentanyl. Just the contact with their hands and the bags at times can be enough to overdose. Fentanyl is primarily being manufactured in China and Mexico, where there is no pharmaceutical quality control. It's being imported into this country by gangs and mixed into heroin. Why? Because it makes the heroin more potent and maximizes the profits for the gangs. We're making something more addictive that is cheaper. The rates of overdose are incredibly high where fentanyl is involved. In fact, of all the numbers I quoted to you about opioid overdoses in 2016, nearly 50% of opioid overdoses were directly related to fentanyl. So why is there such a high risk of overdose? Why are opioids so lethal? Well, at low doses, opioids make people feel sleepy. They minimize pain, they give a general sense of euphoria, and people start to get drowsy. But at higher doses, it can slow the body's rate of breathing and decrease the heart rate, which can lead to death as the person's lungs stop functioning and their heart stops beating and they simply slip away. Now, because the feelings elicited by the use of this drug are so pleasurable, people are willing to continue despite knowing what the risks are. I'll use this as an example, and I apologize for the crudeness of it, but I think it's important to know what we are talking about. The physical feelings, the high experienced by someone who injects heroin is 100 times better than the feeling of the best sexual orgasm they will ever experience. This is how potent these substances are. This is the level of hook that these drugs have. One of the paradoxical challenges that we are seeing when dealing with opioids is that not everyone gets addicted right away. The message, I think, that's been promoted for a long time is, if you do this, you will get hooked. That's true for some people, but not for everyone. So what could happen is that if somebody starts experimenting or recreationally using opioids, they believe they can handle it. I like the feeling, I'm not getting hooked. Or if they see someone else in their life who's doing the same thing and they themselves try it, they might be one of those people who gets addicted right away. Or the person who thinks they can handle it perhaps goes and ingests something without recognizing how much fentanyl was in that product. And they die. Sadly, I was at a funeral last weekend for a person to whom exactly this happened. Someone who recreationally used opioids, believed they could handle it, and from the tox reports, it appears that the final attempt at getting high that she engaged in had a significantly high level of fentanyl, causing her to stop breathing and her heart to stop beating within minutes. What are the problems here? Here in our diocese, what are the challenges that we are seeing? Presently, more Virginians die every day from drug overdoses than from motor vehicle accidents. Last year, 1,445 people died of opioid overdoses. The number of deaths in the diocese has steadily risen since 2011. In 2011, 141 people died of opioid overdoses. That's a combination of both legal and illegal opioids. In 2016, 387 people died of opioid overdoses. This is nearly a threefold increase in our diocese from 2011 to 2016. And in 2016, the 4 counties within our diocese which had the highest number of opioid-related overdose deaths were as follows, in reverse order. Spotsylvania County, my next-door neighbor down in Fredericksburg, 30 people passed away. Loudoun County, 31 people. Prince William County, 59 people. Fairfax County, 97. In fact, Fairfax County has the highest total number of deaths in the whole Commonwealth from 2007 to 2016 from opioids at 437 deaths. 437 souls who succumbed to this crisis. 437 families grieving a loved one. 437 homes trying to pick up the pieces in the aftermath. Because this does not just include the individual. Think of those secondarily affected. Think of the children, the parents, the loved ones whose lives are touched by this scourge. More than 1 million American children now live with grandparents, primarily because of their parents' addiction to opioids and other drugs. Grandparents are putting off retirement and plowing through their savings at an alarming rate to rescue their grandchildren from unsafe living situations. And children are in foster care because their parents are unable to care for them due to their own addictions. Now, the scope of this problem is very broad. This is not, as we have traditionally thought, just an issue among the poor. Middle class and upper middle class families are hit just as hard as poor families in this area, in large part because the prescriptions have opened up a gateway to this epidemic. So this is a problem in our neighborhoods, in our schools, and in our churches. This is around us. And we must respond as a community. So what needs to happen? One of the most important things is that we must address the stigma of drug addiction, because the stigma is a barrier to people getting help. The idea of saying, well, thank goodness I'm an alcoholic, but at least I'm not a drug addict. That can't happen. We're preventing people from getting help if we are not looking at them as people. And remember my example of John and all the countless people who never went looking to become addicted to heroin. We must be willing to show mercy and the love of Christ to those who are afflicted. We must be willing to go out to where the problems are and not wait for them to come to us, because the potency of the drug is that you can get first responders responding to an overdose, administering Narcan to someone who is overdosed, restarting their heart, restarting their lungs, and then the emergency responders leave more Narcan there because they know that it will be needed. They know that being brought back from the brink of death is not enough to convince everyone to stop and change their behaviors. So we must go out. We must go seek the people struggling rather than waiting for them to decide, maybe this last time was too much. We need a multifaceted response. And that's why I'm so delighted to see so many of you here on this Saturday morning. Because to successfully address this crisis here in our diocese, we must include churches. Prayer must be a component as we address this crisis. We must involve families, including those who have a loved one who is struggling or is grieving the loss of a loved one. We must incorporate those who are currently in recovery. Think of the words of our two fantastic testimonies earlier. Peer guides, supports, someone who can say, you can get through this. I have been through to the other side. We must have their voices in our response. We need communities, schools, medical professionals, frontline responders, the police, EMTs, counselors. And each of these groups must be able to inform all of the others about the risks of opioids. Each of these groups needs to be able to support the individuals and families impacted by opioids. And each of these groups has a part to play in seeking to prevent further generations in having the same problem. Think back earlier to the statistics I gave on the people who are 12 and up abusing substances. 6th graders. Are we looking at our next generation of people and families whose lives are in peril? Because with a crisis like this, the only way that we can be successful is responding together. We must have many hands. We must have many hearts. And we must have many minds working together. So what are we doing now? The diocese and Catholic Charities in this diocese. What first steps have we taken? Bishop Burbidge has asked us to make this a priority. And we are here today as part of that response. We started over the summer with a parish-based volunteer conference, a half-day conference, to address this very issue. And we hope that many more events will come out of this conference today, both regionally and, God willing, diocesan-wide in the future. Catholic Charities has a robust counseling program with 22 locations around the diocese. 16 of them are at parishes, including here. We have a counselor here at Good Shepherd providing services in English and Spanish. And let me be clear. The Catholic Charities counselors are not an inpatient treatment facility. They do not do detox. But we want to broaden our scope. We are committed to becoming experts at identifying the key problems and indicators that opioids are at play in the life of a family or an individual. We want to make appropriate referrals for treatment, be that to inpatient or detox. We want to work with family members and loved ones who are struggling with the opioid addiction, and we want to participate in building up a network of comprehensive treatment. So when we see people, we can connect them with what they need. Our Mother of Mercy Free Medical Clinic in Manassas is looking into offering pain management classes, both for our volunteers who are doctors and nurses, but also extending that to patients so they might know what are other options before going the route of prescription medications. Working with local doctors in the community who might not be volunteers but would be interested to know what are some other alternatives. And as Art mentioned, our Welcome Home ministry works with individuals returning from prison who struggle with opioid addiction. And we are partnering with the diocese to create events such as these, where families and professionals from many disciplines can come together and meet with members of the community, and to collaborate so that we may better serve those in need. To this effect, we already have one event that is being planned in Fredericksburg in November. We're hoping to have another similar event in Manassas. So what is our hope for you all for the day? After lunch, we're going to have 3 different breakout sessions. Dr. Paul Nemec from the Diocese of Greensburg will be speaking about what parishes and communities can do. And he will be on that side of the room after the dividing walls come down. Father Mark Hushen will be speaking about suffering, addiction, and the healing power of Jesus. He'll be speaking right here in the main part of the room. And I'll be speaking on building resiliency in families facing the opioid crisis, and I will be on that side. Each talk is going to be given twice, so you have the opportunity to go to 2 of the 3. And all the talks will be recorded, so whichever one you do not see, or in the event that you need to leave early, all of these resources will be available, including for those who were very interested in coming today, but were unable to do so. As I said earlier, the goal of this conference is to start a conversation. More needs to happen after today, much more. At lunch and following the prayer service, my hope is that you will try to connect with the people around you. You come from many different backgrounds. You have invaluable knowledge and experience. which all of us need if we are to be successful in this endeavor. So reach out. Let's start forming this safety net now. Also, we are going to try to launch regional groups. So please look at our sign-up sheets to see in your community, what can you be a part of? How do we take this here and push it out? How do we cover the diocese, not just in the Beltway, but down south to Fredericksburg and Spotsylvania, all the way down the northern neck into Colonial Beach and Kilmarnock, and to the west in Front Royal, Purcellville, Leesburg. Because make no mistake, all of these communities are hurting. All of these communities have souls in need of help. It's my opinion that the way that we will be successful is through engaging a threefold approach. We must support families. We must engage communities. And we must turn to prayer. Families are becoming increasingly disconnected from communities, from each other. Too often I meet families that operate more like people sharing a mailing address and living under one roof than truly connected among the members. This is leading to an increased sense of isolation and hopelessness in our communities. So we must find ways to reconnect families and build communities by creating genuine encounters with one another. And we must turn to faith and prayer. We need transformation. And there is no transformation without Christ. Now, some of you in the room may not be Catholic. Some of you in the room may not even be Christian. So why do we believe this? Why do we believe that Christ is so essential to transformation? It's because within our Catholic faith, we truly believe that God will not ignore our suffering. We believe that He will give us the strength to come together and overcome this crisis as a community. And we believe that people desire and deserve to be loved and embraced no matter what darkness or sorrow they experience in their lives. I hope this is a fruitful day for you all. I hope that you leave not just encouraged, but motivated. Motivated to not continue to watch this go down passively, but to say, what can we do? Because it is my sincere belief that if the fruit of this day is that one person receives help, that one family is spared devastating grief, then this will be a tremendous success. But let's build on that. Let's push that hope out into all the communities across our diocese. Thank you all, and God bless.